Do you know, baby born smaller than their average weight is more likely to develop diabetes, hypertension, and obesity in their later life? Now let's see how small baby looks like. Small baby is comparatively smaller for his age. They are genetically small. Many of their family members were small when they were young. Now moving towards the questions that are asked by doctor. He may ask about baby the height, weight, and the growing pattern of the baby and for how long baby has been small. Some other questions that may be asked by doctor are that, does a baby has problem related to breathing, exercising, and eating? Or any bluish or purplish discoloration of the skin? Or smelly and greasy bowel movements, vomiting, constipation, diarrhea, fever, tiredness, and any changes in growth? Let's have an overview of physical examinations that baby will undergo by the doctor that may include the examination of muscular strength, height, weight, size of the head, body temperature, listening to the heartbeat using the stethoscope, examination of the abdomen and legs, enlarged lymph nodes. Doctor will also view the medication history of the baby. Your doctor may ask about the dietary history of the baby and the family history, such as whether there have been any recent births, deaths, or hospitalizations, and other family history that he may ask that the baby or anyone in baby's family had suffered from any illness that have been cured, such as chronic kidney disease, cystic fibrosis, HIV, or any other chronic disease. Let's discuss the major causes that leads to small size in baby and their typical symptoms. These causes are cystic fibrosis, inadequate feeding, hypothyroidism, growth hormone deficiency, enzyme deficiency disease, and chronic disease. First major cause is inadequate feeding. Mother feeding is full of nutrients that are required for normal body growth of the baby, so inadequate feeding could lead to size of the baby to be small. Let's discuss the typical symptoms of inadequate feeding that includes protuberant abdomen, that is, unusual convexity of the abdomen usually caused by poor muscle tone or excessive subcutaneous fat. Weight loss, more increase in height than weight due to fear of overfeeding of child by the caregivers, so baby may not getting enough fluid with meals in warm climate. The second major cause is cystic fibrosis. It's a genetic disease in which body undergo changes, such as diarrhea, recurrent lungs infection, and other problems. The typical symptoms of this disease are frequent lungs infection, smell and greasiness in stool because the mucus is often thick and stick that blocks ducts in pancreas and prevents enzyme from reaching the small intestine to digest food. The undigested food in intestine can cause pain, cramps, gas, and either loose, greasy, floating stool or may cause blockage. Family history of fibrocystic disease, protuberant abdomen, more increase of height and weight. Do you know what is fibrocystic disease? Third cause being the enzyme deficiency disease, in which baby lacks the needed protein. To understand it better, let's discuss the typical symptoms that are included in the enzyme deficiency disease are vomiting after consumption of milk and other food because baby is lacking the enzyme known as lactase needed for digestion of milk and milk products. Moving forward to fourth major cause of small size in baby, that is hypothyroidism. Hypothyroidism is disease in which activity of thyroid gland is lower as compared to normal thyroid gland. It's the condition opposite to the hyperthyroidism, in which thyroid gland is overactive. The typical symptoms of due to underactive thyroid gland is prolonged yellowing of skin after birth. This yellowing of skin is due to the increase of carotene in dermis. Constipation due to low level of thyroid hormones, such as T3 and T4, leading to decreased gastric motility. And mottled skin as newborn. Let's discuss the third last cause of small baby and its typical symptoms, and that is one of the hormones needed for normal growth called as growth hormone. Let's briefly understand the mechanism of release of growth hormone. Hypothalamus releases the growth hormone releasing hormone. This growth hormone releasing hormone acts on anterior pituitary to release growth hormone that acts on target tissues, such as increased cell growth and proliferation, results in increased bone length and muscles mass. Other effects, such as diabetogenic effect, means increased glycogen breakdown to increase blood glucose level, and other effect is glucose-sparing effect means increased lipolysis and decreased glucose uptake. So due to low growth hormone, typical symptoms that appears in small baby are normal birth weight, but slow growth and delayed teeth growth. Moving forward to second last cause of small baby, and that's the growth lags means low body growth due to illness or body stress. The last cause of small baby being the chronic disease or infection, such as lungs, heart or kidney disease, HIV, or intestinal parasite symptoms that typically appears due to this cause are lesser weight than the height, weight loss, protuberant abdomen. Baby exhibits problem with heart, lungs, and abdomen. Now, based on the diagnosis, you can manage your patient accordingly. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.